The latest figures for Ebola show nearly 14,000 cases in 8 countries, with the death toll approaching 5,000.
Now, shocking news, and we're sending some soldiers to Sierra Leone as the outbreak of Ebola is getting worse there.
Yes, Dr. Chris Luke is back with us. Doctor, there was a story in the news during the week about a woman in Belfast who we thought may have Ebola was actually malaria. What are the chances that it will land on our shores?
The chances are pretty minuscule, Dahi, really. And in fact, I think most people like me in the front line would have suspected that that case in Belfast was going to be malaria, as it turned out to be. Now, obviously, there's about 24 hours before you can be sure that it is not Ebola. But the chances of Ebola coming to us are really very, very minimal. There's only been 3 cases that have been acquired outside Africa. And they were the 3 healthcare workers in Spain and the United States.
Yeah.
You know, and they've done pretty well. So the chances of it being spread to us, there's no direct flights, for instance, from the 3 main countries, Sierra Leone, Guinea, Liberia. So really and truly, our main focus should be on containing this horrible disease in those 3 countries, because they're blighted by a lack of resources to isolate, care for and bury the victims of this horrible virus.
And that's actually, we interviewed someone from Medicine Sans Frontières, and that's where they were saying that really, to be honest, not to turn people off helping these countries, and the on-the-ground and line of defence there is very bad. I mean, they just don't have the equipment.
These people Sierra Leone has something like 500 beds for Ebola when it should have at least 4,000. So the soldiers from our defence forces and the UK and so forth and the States are going in there and are building these sort of field hospitals with 100 beds, 200 beds. And that's incredibly important, because if we can contain the disease there, the chances of it affecting the West are minuscule.
What about our own soldiers going out to Sierra Leone? Are they in danger of anything?
Very little, really. You have to be in touch with a very sick case of an Ebola illness. A case that where the person is actually very, very ill. They're feverish, they look unwell, they feel unwell, and you're in touch with their bodily fluids. We're talking about blood, sweat and tears and everything in between.
So if you have all the gear on,
if you have all the gear,
you'll be fine.
And the patient is not sick, and there's no bodily fluids involved, then you're really at little or no risk. And most of the disease has been spread through preparing victims for burial, for instance, or in caring for the victims.
Was this in the early stages where
they
didn't know a whole pile about it in one sense?
I mean, there was one notorious case there where a faith healer in southern Guinea, she was approached by she was a very famous faith healer in the southern part of Guinea. She was approached by many of the early victims. Tragically and predictably, she got the disease, and then 360 people who went to her funeral subsequently died. So there was an explosive and very ironic consequence of that.
Chris, there was talk probably going back about 3 weeks ago now. Now, it seems to have, I heard the head of the Nigerian side of things there the other day, saying they're hoping that they're containing it, slowing down. Now, I know Liberia, but I think Guinea, it's still continuing in these places. But they were saying that it could mutate, that the virus can mutate into different and get more serious as it goes along. Is that possible?
Yes.
Do you think that's still possible?
That's the thing that they're most afraid of, is that we do not contain it this time. It will mutate and become very much more contagious and resistant to the vaccines and treatment that are in evolution.
This is it there. This is the actual virus.
Now, it's a very, very scary virus. It seems to come from primates like bats and monkeys in the jungle, in the tropical forests.
And has it always been there?
It's probably always been there and mutating, but it was within the bat and primate population. But of course, that's called bush food, and they eat some of the tribes in that part of the world eat it and they spread it. And then when the humans you get human-to-human contact because the humans become very, very ill. And when there's fluid like vomit and all the other things, and it's contact with that fluid that leads to the disease being spread.
What about people flying and all this now? People are saying, again, it's kind of scaremongering. Like, what if I breathe the air in a plane and all that? I know that that's just forget it.
We've talked about flu and head colds and so forth on this program before, but Ebola is not spread through the air. It's not an aerosolized. No, it's not spread by sneezing or coughing. It doesn't transmit through the air. It's fluid. You have to be in touch with the fluid, your skin, and actually theoretically it should be through a breach in your skin, which is why,
like a cut or something.
Well, exactly. Which is why you see these costumes, and the carers are supposed to be covered, and there's not supposed to be a centimetre of skin
even your
exposed.
mouth, anything,
nothing exposed.
nasal,
hood and gown and feet, everything wrapped.
So I know, because I suppose when the story started coming out in the beginning, Chris, especially from the American media, they were very vague about a lot of stuff. Because even my own wife and child, they were heading over to the States, and Rita was actually half thinking, will I, won't I go over, just in case something would
That's
happen.
That's what I mean about
yeah,
the
because
flying
everybody was
people
very
were-
vague about
It
it.
gives you the power of panic. The power of panic. Perspective. 600,000 people would have died from malaria
That's true.
in the
Perspective,
past 12 months. Cases such as that in Belfast, they're the ones who pitch up. They've travelled from West Africa, they have a fever, they're very sick, they're sore, they've headaches, they've aches and pains. They are likely to have malaria. And 1,400 cases of malaria were imported into the UK last year. 2 died. They're the real risks, but perspective is very important.
Would Ebola people have the same symptoms, would they? Or something
Ebola,
similar to Ebola?
how Ebola presents, you are within 3 weeks, between 3 days and 3 weeks of touching the fluid of somebody who has died or been very ill, you suddenly become ill, you have a fever, severe headache, aches and pains everywhere, and you're very, very ill, listless, exhausted, and you hit the bed, and that's really it.
That's
so
it.
you look sick and you feel sick.
We've got a question in here from one of our viewers. This is May in Kerry. She says, I have a few autoimmune diseases, SLE being the most serious. I'm also on several medications, including methotrexate.
Methotrexate.
Would she be at a higher risk of contracting the disease if she was exposed?
I don't think so, because people who are in absolutely pristine health, whose
Get it.
immune systems are 110% effective, still get it. So it doesn't seem to have anything to do with the innate resistance of the victim.
Have you ever come across it? I know you did work in Africa years ago.
No, I came across very severe, very comparable viral illnesses. I worked in Zambia with a very famous missionary nun, Sister Lucy O'Brien, who was actually the great influence on my career. She'd started in Sierra Leone, actually, but she was the great influence in my life. And she's the reason why I'm a sort of internal missionary. So I did come across a lot of severe tropical illnesses, but Ebola is really, this is new and it's very nasty.
Okay. Chris, thank you very
Dr.
much
Chris,
for
thank
coming
you very
in.
much.
It's great.
I hope you'll visit us again very soon.
Yes, we've been trying
Yes,
to
we
get
miss
you
you.
in.
We
We
miss
are
you, Dr.
begging
Chris.
you every week. I know you're so
We are a
busy.
little busy at the front line, unfortunately,
you
at the
are.
moment.
But we're busy too. We want
I
you
know.
here too, Chris. So you're going to have to make time
I know,
for us.
touche. I'll be back.
We said
I'll
this
be
live
back.
on air now, there's no excuse.
I'll be back.
More information on Ebola,
course.
if you can go to the hse.ie.